Hi everyone, I'm Dr. Justin Lin here at Rehab Physical Therapy. We want to talk about probably one of the best and most stable back stabilizing exercises I can teach you. This is called the Liftoff Exercise.
Liftoff, we have a liftoff.
Because you're just lifting off your knee, off the surface. What this does is it stimulates the small muscles along your spine. So if I'm lifting off the right leg, I'm feeling at my left of my spine. And if I'm lifting off the left leg, I'm feeling on the right of my spine. This is a little bit of a different progression than what we've done in the past. So we're making it a little bit more difficult. Stay tuned. All right, you want to set yourself up on a hard surface or a yoga mat, and you want to be on your all fours. I used to teach this exercise on your hands and wrists, and that's a step down. If you want to make it a little easier, you can do it this way. But today we're going to talk about it on your elbows, and I've been teaching this more and more to start here. Our goal is just to unweight this leg, and when you're unweighting the leg, it's like I said, it's affecting the other side's spine muscles. But you just want to be able to slide a small sliver of a sheet of paper underneath, and that's how you achieve this exercise goal. But even if your knee is still on the surface, then it's okay. You can still just unweight it 10%, 20%, 30%, 50%, and you're still touching the surface. And that's still a good workout for your spine. So the goal is just make sure you're not shifting, twisting, those are compensations, or like a boy dog trying to, eliminate on the fire hydrant. So what you want to do is pretend there's a small cup on my back, and even the water doesn't even move. Or you can use a dowel and make sure it doesn't wobble at all. So the goal is it's like a statue, and I say that a lot. You want to be able to just unweight that surface or unweight the left leg I'm using, and you barely can tell that I'm already at 80% unweighted. Now, as soon as I get this, then you can see that I can kind of move that around, and that's already what it is, and that's really the goal. You want to hold that though once you've got it to that spot that's challenging, and you hold it till the shakiness stops. That's the exercise. And that's going to be the big thing, is that you hold it till the shakiness stops, and then you try the other side, and that's going to be the goal. So the whole point is that we're stabilizing that spine, and anything that's loose, we want to make it tight, and that's going to be a very powerful exercise, a very powerful core exercise, because if you can't do this, what makes you think you can do other harder things like deadlifting or squatting? So that's something to think about. So hopefully you found that this exercise stimulated those multifidi muscles that were going to benefit and help you reduce some of the pain, make your spine a little bit more stable. Just like a statue is what I always tell you, you want to make sure you're lifting up and no one can tell you you're even moving or lifting off that knee. Also, another recommendation, as I've said, is that you want to pretend that there's a cup of water on your back, and even the water inside that cup isn't moving or jostling around. So if you like what we're doing, please leave some likes, subscribe below, and leave us some comments. I'm Dr. Lin. Remember, we heal smarter, not harder.